Hello, Mr. Johnson. It's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and you're laying on your side. So the ball part of the ball and socket joint's at the top of the screen, and the socket's down below. Now you can see there's a lot of things torn here. We've got a shaver coming in that has suction attached to it. And as you turn on the suction and turn on the blades, you can start to smooth out some of these rough areas and get a better idea of exactly what's going on. This is your biceps tendon on the right side of the shaver, and then as we look at this side, we can look at this biceps, we can tug on it, we can see if it's torn. We can look down at the anchor, and we can see some fraying here as well. We'll look up at the rotator cuff, which is right here, and this is where we've got some tearing, which is what we expected. We can see the old sutures right here. Pull back a little bit. Okay, there's some of the old suture material from your old surgery. You can see how they're loose. I think we might want to go ahead and take these out now. We'll take a pair of scissors. And then we'll take a grasper, and we'll get this suture out. We'll show you some more in just a minute. Pause, please. Okay, so now we're going to go ahead and finish smoothing out some of these rough areas. As we look down the front of the shoulder, we can see the anterior labrum. And that looks pretty good, actually. We can see some areas where the cartilage on the glenoid is a little bit roughened up here. We'll try and smooth these areas out. And then we'll come back up to the rotator interval. And as we look at this biceps anchor, I'm just worried that if I leave this, it's going to be a source of pain, and I don't want to leave anything that could still hurt you, especially since this is your second go-round, even though it's been a number of years since the first time. So I think we will do a biceps tenodesis here. We'll take a spinal needle. And you can see how we're going to pass this needle right through the middle of the biceps tendon here. There it goes there. And then we're going to take a black wire that we call a super shuttle and pass it through the needle. We'll take a grasper, and we're going to grab the wire here, and we'll back the needle out, and then we'll go ahead and take a stitch. And that's the first half. And now the second part of what we have to do is just pass that needle one more time. Get a little bit higher than that. That's pretty good. And then we'll pass that black wire once again. Okay, and now we're going to reach on the other side of the biceps to retrieve the wire here. Like that. We'll show you some more in just a minute. Pause, please. Okay, so now we'll go ahead and here, give that to him so we don't lose it. We'll go ahead and cut the biceps tendon now. And that's what we're doing here. We've got a pair of scissors in. And now the biceps is released, so that won't cause any more problems inside the joint. We'll go ahead and smooth out what's left behind here. Okay. And now we're going to look towards the posterior labrum and see how much of this posterior superior, let me take that, posterior superior labrum we can see. Okay, so that looks reasonable. Okay, I don't see any other significant tears. And so now the next step is to go ahead and pass a spinal needle through the area of the cuff that's torn. Pull back a little bit. And this is the area where it's really thin, and this is what showed up on the MRI scan right there. Okay, and so we'll go ahead and pass our marker stitch through there, and then we'll go off on the video and change positions with your shoulder. Pause, please. Okay, so we're looking at this hole in the rotator cuff tendon. You can see the hole here. In the prior surgery, there's a kind of a big cystic hole right here that we're going to have to avoid. But we are going to want to get our first anchor down, if we can, somewhere down about here. Okay, so there's a little hole in the bone that we've made. And then we'll screw down a titanium suture anchor. Here it is here. And we'll get this started in the same hole. And then once it's down far enough, we'll go ahead and unload the screwdriver. And then we'll have 3 different sutures to work with. They're color-coded. So we'll reach in and spread them apart here and decide which ones we're going to work with first. So it looks like they lay out just like that. So that's, what is that, white, black and white, then blue and white. We're going to work from left to right. So what we want to do is reach in here and get this white suture first, like that, without unloading. Okay, and so now we're going to take our suture hook, which is a needle basically that comes in on the left side of the screen. Here it is here. And it's loaded with that same black wire we showed you for the biceps tendon. You want to reach in and take this, show me on up above. There we are, poking through. We'll go ahead and feed that wire. outside your shoulder, we're going to load that wire with that white suture, and as we pull back, you'll see how it brings that suture with it there. It comes up right over here. Now we'll go ahead and reach in and get the partner suture. We use a turn to the right next. Okay. And I think the next suture we decided was the black one. Right. So we'll take this black suture next. Black and white striped suture, I should say. Then we'll take another suture hook. This one curves a little bit more than the first one. Okay, so there it is. So this one will start back here. There we are coming through there. Okay, now we'll load this one up with a stitch. Okay. What are you stuck on? We'll keep working here and show you some more in a little bit. Pause, please. If you've got our first anchor and all three sutures pass without any problem, one of your suture anchors from your prior surgery is created, or I don't know if it's created it, but it's in a spot where there's now a big hole in the bone. And sometimes cysts can look like this, but certainly we can't use that for our next anchor. So I think we're going to have to just do the next best thing and just cheat back a little bit to here and see if we can get a good hold. Okay. So we'll go off on the video. I just wanted to show you what we're having to do here. Okay, so we're showing you here, we're just starting to work on actually the second anchor. We've already tied all three sutures from the first anchor. And as we look down at the cuff, you can see that we've already gone a long way towards closing up the initial hole, which was back here. We've still got a little bit here. But things are coming along just fine. I just want to give you kind of a progress report. So we'll show you how we tie one of these sutures here. And there it is, sliding down into position. Of course, we know we have that big cyst right underneath the cuff here, so we want to tie these securely since the anatomy is not quite normal compared to what we typically come across. But I think this will work fine. It looks like we're getting a strong repair, so that's the most encouraging thing. This tendon has obviously been operated on once before and then had a subsequent injury, so the tendon's not in the greatest shape, but as we talked about in the office, our goal today is just to get you in the best possible position to get this to heal. We'll go ahead and cut those suture tails. And after we tie the next two sutures for the rotator cuff repair, then we'll have the sutures from the biceps tenodesis to tie, and then we'll be done. So now the next thing we want here is the black and white suture. That one. And that one. So we'll get these tied and show you some more in just a minute. Pause, please. Okay, so we've tied all 6 sutures to repair the cuff, and it looks good. Even we've covered up a bit. You can see everything moves together. We've still got to get our bicep sutures, which are going to be right up here. And that's what we're going to reach in and get next. And then once we tie those, we'll be finished. Look in the back, please. So there's one of the bicep sutures right there. And we'll get the other one and tie it and show you when we're done. Okay, we're just finishing up. The suture that you see us tying there is for your biceps tenodesis. And we're just about done with that. And now all we have left to do is just to have one last look at the bone, make sure there's no additional bone work that we need to worry about. And let me see the burr. We'll do a little bit of that, smoothing of the acromion, and then we'll go ahead and put in a pain pump and get you back to the recovery room. So I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.